Welcome to the NWAETC Project Echo. I'm Kent Unruh, and I'd like to turn it over to Brian Wood, our medical director, to introduce our guest.
Great. A big thank you to Shrisha Danareddy for coming to the talk today. Shrisha should be very familiar to you guys. She's part of our expert panel here, and she's assistant director over at our Madison Clinic, and I will turn it over to Shrisha.
Thanks, Brian. Thank you for inviting me to do this talk. This is actually usually an interactive talk for me, but so it'll probably go faster without being interactive. But what I wanted to do is hit some basic principles about legal and ethical issues in HIV in the context of sort of broad biomedical principles, and then as they pertain to HIV in particular. And I also wanted to give you some knowledge about things that you can tell your patients about their protections, and also review a concept called behaviors endangering public health. So the four basic bioethical principles you've probably all heard of, and this obviously doesn't just relate to HIV, is autonomy, respect for the individual, beneficence. Of course, we all want to do good for our patients and not harm them, which is a malfeasance. And then justice, being fair for the wider community. And of course, this obviously pertains to individuals with HIV as well. So I wanted to illustrate things in a case format. And these cases might be familiar to you, or you might have had patients who've experienced similar things. So a 40-year-old man who discloses his HIV status to his pastor, who then proceeds to inform potential employer and co-employees of his HIV status, as well as other members of the congregation. And the patient asks you, as his provider, what you can do about this. So this is an actual patient. And so the options are: tell him there's no legal recourse against the employer's actions, seek advice from a public health officer, call the local prosecutor, or do not advise at all, because that's not your role as a provider. So just to move forward, this is obviously a case of inappropriate disclosure. So this is a confidential discussion that the patient had with his pastor about his status, and then the pastor went ahead and disclosed to other people, including his employer. It's interesting because this was data from a survey in King County here in Washington that looked at policy preferences for people regarding people with HIV/AIDS. And interestingly, people felt that HIV persons should be required to report their status to their employees about half the time, which is really interesting. And just below that, HIV-infected people knowingly infected others should be arrested and imprisoned, and you can see a high percentage there. We'll get back to that concept as there are some new things going on with HIV and decriminalization. So why do we talk about this, and why is this such a big issue? Because there is a lot of misperception about HIV and stigma and discrimination, as we all know, and that's the fear that patients have when they do disclose to somebody that they're going to treat them differently. There are some legal issues around that, and I'll talk about that in particular. And then behaviors endangering public health are often present the most difficult ethical issues, and I'll talk specifically about this BEPH. And then the role of the public health department is a really important one, and I think that is the correct answer in this setting, is to talk to public health and see what they can do. I think from a provider perspective, it's really hard to advocate in terms of legal ramifications for the patient. But that is something that the patient can do on their own. In terms of misperceptions that persist and can do harm, these are just examples, and there was actually just one in the paper recently about a 13-year-old boy who was denied admission to a private school based on HIV status. But there are obviously many other examples of this in the media. And as I mentioned, stigma exists. There's a high percentage of people who are at risk who test for HIV anonymously because they have the fear that these results are going to be somehow disseminated to others. And some people sometimes don't even test because of the fear of that information getting out to insurance, to family, etc. There are obviously when we talk to patients, when they establish care to us, one of the first questions I ask people is, have you told anybody about your HIV status? And I'm surprised, how many people have actually told other people, like family members, because it is very common to not disclose, especially early after infection when they feel that there will be a lot of stigma and they haven't come to terms with the diagnosis themselves. And as we all know, not everybody discloses HIV status to sexual partners. And sometimes they make assumptions about whether other people are positive because they're in a bathhouse having unprotected sex, so they just figure it out, well, they're positive too, I don't need to talk about it. And then just briefly, I wanted to talk about the AIDS Omnibus law here in Washington in 1988, and I'm not sure if there are similar laws in your areas, but these are protections for people living with HIV. So no person may require HIV or hepatitis C testing as a condition for hiring, promotion, or continued employment. And so that's really important to know. And then it's illegal to discriminate against persons with HIV for jobs, for housing, for public accommodations. And it's also illegal to disclose that a person has tested for HIV or has tested positive for other STDs, except in a medical care setting. So this obviously applies to this person here, that he should know that he has protections, legal protections. But despite this legal protections, discrimination still exists, and people aren't aware that they can actually seek help, and they're very disempowered by this. So moving on to case 2, this may also be familiar to some people. So you discover that a 30-year-old HIV-positive male-to-female transgender has placed an ad in a local paper to offer escort services. She is also known to have multiple partners and is not disclosing her HIV status. So I'm sure that many of you have had patients who are not disclosing to partners. So what is your role in this as the medical care provider for this person, but also as someone who cares about the health of the community? So is your role just to take care of this patient and you have no obligation? Or do you notify public health? Do you counsel her to disclose to HIV partners and use condoms, or notify the police? So this is an interesting question, and it's more than one answer is correct, and we'll talk about this. So what about this issue of duty to warn and permissive disclosure? There have been cases of this duty to warn, and there are some famous ones involving an imminent danger to someone who says to a psychiatrist, like Dr. Udelis Flores, a patient will say to her, I will plan to go out and kill this person. Well, in that situation, you do have permissive disclosure because there is an imminent danger to that person. That you have a duty to warn and break that confidentiality between provider and patient. And aside from those kind of dramatic cases, there is a role for public health. In this situation, this person, there's not an active transmission going on every time that they have sex. And so this actually doesn't fit into that duty to warn and imminent danger model. And then the role of the provider, of course, you should be talking to your patients about risk reduction and how they can take steps, because some patients don't know about transmission risk and how they're endangering their partners. And so I want to be brief about the time, but just, obviously the duty to warn is to protect the patient's rights, but also to protect the patients and others and not bring harm to the patient or others, and to be fair, this idea of justice to the wider community. So as I mentioned, when there's serious harm to a third party, you may disclose. When there's a victim of abuse, so for instance, if it's a child or another adult, and then even more so for a child when their overall best interests may not be being met by this parent or guardian. And then, of course, like I mentioned, preventing or detecting a serious crime. So the role of public health, I mentioned in both of these cases that public health will have an important role. Besides, we all know that public health does partner notification. So in the case of this second case, this person is putting an ad out and having sex with lots of other individuals. So the public health can go out and do partner notification and actually identify, without identifying the patient as their contact, so it would be done anonymously, they can go out and test and make sure that these people have not seroconverted. And like I mentioned, that's the contact tracing. There's also this idea of behaviors endangering public health. So a lot of individuals who have HIV, we know, have comorbid mental illness, substance abuse, and it's not necessarily that they are volitionally doing this to infect others, but they're not being thoughtful about it, essentially. But if they are volitionally going out and infecting others, their public health does have some ways to deal with that. One is a legal step is called an order to cease and desist. So they can actually say to someone, we are going to get a legal order that you stop this. And then if that person continues to have endangering behaviors to others, there is potential legal action. I was told by the previous director of public health, STD, HIV in King County that they'd only had to use this once in his career. So most of the time they go in and they talk and they provide counseling and talk to them about their behaviors, and they do cease to happen with public health intervention. And so that's kind of what I mentioned there, the 3 levels here. We'll go through there. And then obviously, like I mentioned, there's a lot of factors of impairing ability to behave safely, like we know, and that it's really hard for our patients to necessarily think about their risk to others when they're dealing with a lot of these other issues, or if their mechanism of getting income is by prostitution or other means. So there are a lot of deficiencies in our current system because obviously it doesn't work very smoothly necessarily. So the local health department can do the partner notification services, like I mentioned, but there's actually no stipulation in terms of the timing and the responsibility and the duration of monitoring for ongoing potential risk to partners. So that's not clearly delineated. And the only practical intervention that public health really has is a cease and desist order. And then it becomes problematic when someone is working for the public health greater good, and then what happens if more of a legal entity gets in, like a prosecutor, and then there's concern for legal action against the patient. So the patient no longer feels like someone is working with them, they feel like someone is working against them. And that could really impact the provider-patient relationship and the public health-patient relationship as well. And like I mentioned, that careless transmission is a lot more common than volitionally trying to infect others. So people aren't thinking clearly about the transmission risk for whatever reason, or they're taking calculated risks, like sorting, positioning that we've all heard about, partner selection, so only from areas like bathhouses where they think that there's a higher prevalence of people that are HIV, or just by avoiding disclosure, which is probably the most common thing where people aren't really just talking about their HIV status. And then I wanted to mention this briefly because I'm sure you all have seen this in the news about the effort for HIV decriminalization. So aside from the public health arena, there's actually a legal, there's laws in 34 states, so the majority of states, that punish people for exposing another person to HIV. So this is just exposing. It doesn't matter whether transmission occurred or if condoms were used. And so that is a concern for people with HIV because it really stigmatizes the disease. So even if people are acting safely, there could be legal action against them. And so there are people in Congress who are working to repeal these laws, but they are, the word is that they're not likely to be successful. There is a case that was actually eloquently written about in Spokane that you all might have read about, of a young gentleman who was involved with another woman who invited another partner into the relationship, a woman. They did not disclose the status, his status being HIV positive. He was undetectable. She did not acquire the virus, but he actually went to prison for many, many years as a result of this exposure to a woman who did not get infected. So his whole life was changed by that event. So in terms of what you can tell your patients, obviously disclosure is really, really important. It's akin to informed consent for the partner. And disclosure protects you in some cases legally, but not always, but medically and ethically. And careless spread of HIV can lead to legal consequences that your patient should know about, including court-ordered confinement, but also if you do have a law in your state that criminalizes exposure, it's really important that they know what they may be getting into. Thank you.